These cystic lesions are what eventually lead to the clinical manifestations of cysticercosis. However, the onset of symptoms may take anywhere from 5 months to 30 years, and the clinical presentation can vary considerably based on the location of the cysticerci. The most frequently afflicted areas of the body include the brain, eye, musculature, and subcutaneous tissues. As a result, cysticercosis can be classified into parenchymal neurocysticercosis, extraparenchymal neurocysticercosis, and extraneural cysticercosis. We will discuss each of these in turn. Parenchymal neurocysticercosis, as shown in these images, is the most common form of neurocysticercosis and the leading cause of adult-onset epilepsy in endemic parts of the world. It is estimated that the prevalence of epilepsy due to neurocysticercosis in certain communities is as high as 3%. Symptoms usually occur within 3 to 5 years of infection, but can be delayed for decades. Focal seizures, with or without secondary generalization, is the most frequent clinical manifestation of the disease, with severity dependent upon the location, number, and associated inflammatory response to the cysticerci. Other associated symptoms include headache, nausea and vomiting, altered mental status, vision changes, and fever. In both the gross pathology on the left and the CT scan on the right, multiple cysticerci are present in the brain parenchyma, with the scoliosis easily identifiable within each image. Spinal parenchymal neurocysticercosis, as the name implies, refers to cystic involvement of the spinal cord with inflammation and demyelination of the peripheral nerve roots, causing radiculopathy and paresthesias. In contrast, extraparenchymal neurocysticercosis may involve the ventricles, subarachnoid space, or eye. Intraventricular neurocysticercosis refers to cystic involvement of the ventricular system with resultant blockage of CSF outflow, increased intracranial pressure, and hydrocephalus. Associated symptoms include papilledema, headaches, nausea and vomiting, altered mental status, and vision changes. Subarachnoid neurocysticercosis refers to cystic involvement of the subarachnoid space with subsequent inflammation that can lead to cranial nerve palsies, focal neurological deficits, ataxia, meningitis, vasculitis, stroke, and hydrocephalus. Additionally, these cysts can grow into large lobulated masses reaching sizes of 10 centimeters and larger, causing mass effect on surrounding structures. Ophthalmic cysticercosis may involve the globe, as seen on the right, extraocular muscles, and conjunctiva, as seen on the left, leading to eye pain, vision loss, and diplopia. Extraneural cysticercosis may involve the musculature, subcutaneous tissue, and other organ systems. Intramuscular cysticercosis is usually asymptomatic. However, it can be associated with fever, eosinophilia, myositis, and muscular pseudohypertrophy, a condition in which there is initial swelling of the musculature that later progresses to atrophy and fibrosis. The image shown here is an X-ray of the knees demonstrating characteristic, quote, cigar-shaped calcifications, or, quote, rice bodies within the musculature. Subcutaneous cysticercosis typically presents with scattered 0.5 to 2 centimeter firm, mobile nodules found mainly on the trunk and extremities.